For 2 weeks, resident doctors have been on strike, the third one this year alone. Negotiations over their 12-point demands appear to have failed, and neither side is willing to sheath their sword. The crisis in the medical sector is coming in the midst of a global pandemic and an outbreak of cholera in Nigeria.
We have been having long meetings with the young doctors to tell them that, look, we have a certain responsibility to our country. Every country who has difficult situation at this time should understand that the responsibility is for all of us. If you have any problem, any grudges, let's talk about it. If we can't solve it now, let's continue talking until we find solution, but don't drop work.
The federal government claims that most of their demands have been met. It's worried that a strike may hamper Nigeria's fight against COVID-19.
Your salary comes from taxpayers' money. So if it didn't work, why should you go and be saying you should be paid? Because if that is so, you can be encouraged to stay home for 6 months, and your salary is running from public funds, from taxpayers' money, and you have not given the community any service. So that no work, no pay is not just a government regulation. It's recommended, it's specifically stated in ILO regulations.
The rising number of the COVID-19 infection is disturbing, and the number of those already vaccinated is still a far cry from the 70% target of the government. Nigeria is in a race against time.
Yesterday, we recorded the highest number of single cases in a day in the third wave. We had higher numbers on the day in the second wave, but really, day to day, week to week, over the last few weeks, our cases are increasing.
The percentage of Nigerians that have been vaccinated so far is 2.3% of eligible Nigerians. We plan to vaccinate this population, about 112 million Nigerians, within a span of 2 years, starting from when we rolled out the vaccine. And this is still dependent on the availability of vaccines, right? So if, for example, we go through a long stretch without vaccines, right? That means we cannot be vaccinating, and you cannot count that as among the 2 years that we've provided.
To beat the 2022 target, Nigeria is speeding up its vaccination campaign after an initial delay.
With the arrival of the Moderna vaccine, we found out that the barcoding that is needed for the traceability was not full barcoding compared to the Covishield that we got from India. India is a little bit more advanced in barcoding, labeling, and it has nothing to do with the quality. No, it is just ability to be able to track using barcoding how the vaccines move. So what we then had to do with the Moderna vaccine is to add another label to the packaging.
An additional 40 million single dose of the Johnson & Johnson vaccines are being purchased, apart from the first 29 million doses already paid for.
It was $10 when we first started, but the price came down, and then that means we get more than we had actually originally booked. So that we boost our vaccine stock, and that tells you clearly that majority of vaccines going to be used in Nigeria is procured by government. It's not just a gift.
Despite the rising cases, the Minister of Health rules out the possibility of another lockdown. But while efforts are being made to contain the spread, the government advises Nigerians to maintain public health measures. Egusa Higumbo, Arise News.